Welcome to The Explainer. Today, we're diving into a really crucial update from the Office of Developmental Programs regarding Medicaid renewals for folks in Pennsylvania's support system. We're going to unpack the exact responsibilities, the changing laws, and of course, the technical tools you absolutely need to know.
So, here is our roadmap for today. We're going to cover the stakes of Medicaid eligibility, the impact of the OBBA, a provider's support playbook, navigating payees and MAWD, and finally, essential tools for verification.
All right, Part 1, Stakes of Medicaid Eligibility. Why this matters now.
Understanding the real-world impact is really the foundation of everything we're discussing today. Basically, if an individual's medical assistance lapses, they completely lose their critical physical and behavioral health care. And let's be super clear about what that means for you as an organization. If you provide services during that lapse, you are likely not getting paid. It's just a lose-lose scenario that we absolutely have to prevent.
And to help us prevent those lapses, we have some official guidance. Right here is announcement number 25097, released by the PA Department of Human Services late in 2025. It lays out exactly how providers, supports coordinators, and administrative entities can support individuals to maintain their eligibility through their local county assistance offices.
Moving right along to Section 2, Impact of the OBBA, Shifting the Goalposts.
So what's the inciting incident causing all these changes to eligibility determinations at the county level? Well, it's the federal One Big Beautiful Bill Act, or H.R. 1 for short, which passed in 2025. Its changes to how public benefits like medical assistance, SNAP for food, and TANF for cash assistance are evaluated are going to phase in over this year and next. So it's not just a one-and-done shift, it's a rolling implementation.
Now, who's actually implementing these changes on the ground? That falls to the CAO, or County Assistance Office. Because of this new law, the CAO might totally change what documentation they request, and even how often they request it. This makes it absolutely vital for individuals and their representative payees to respond to CAO notices by the exact deadlines provided. Renewal dates aren't necessarily going to just be the same month year after year anymore.
Okay, let's jump into Section 3, a provider's support playbook, your roles and responsibilities.
Now, while you aren't expected to be some Medicaid expert who knows every single income limit off the top of your head, you do have core responsibilities here. You've got to actively guide individuals through this renewal maze. You need to reinforce why this matters, assist with gathering documents, help them get past barriers like, say, a lack of transportation to appointments, monitor their deadlines, and ultimately empower them with ongoing support so they can navigate the system totally independently in the future.
A huge part of this playbook is helping folks report life changes quickly. We're talking changes in income, household size, or employment. These 3 steps outline the absolute fastest ways to do that in Pennsylvania. You can go online through Compass, use the My Compass PA mobile app, or simply pick up the phone and call 1-877-395-8930. Keeping their info accurate is literally what keeps their benefits active.
All right, on to Section 4, Navigating Pays and MAWD, Specialized Support.
First up, let's talk about the representative payee. This is a person or organization carefully evaluated and appointed by the Social Security Administration. Their main job? To manage payments for an individual's current maintenance, which basically means food, shelter, and medical care. Because they're so heavily involved in the individual's finances, they play a massive role in the Medicaid renewal process. You'll want to make absolutely sure they receive this specific Medicaid Guide handout that was attached to the ODP announcement.
We also have this really vital safety net for employed individuals, medical assistance for workers with disabilities, or MAW. Think about it for a second. If someone you support starts a new job, they might suddenly get denied standard MA just because of their new earnings. You've got to pivot and encourage them to ask the CAO for an MAW application. MAW actually has higher income and resource limits, which ensures they don't have to choose between working a job they love and keeping their essential health care.
Let's wrap things up with Section 5, Essential Tools for Verification, Securing the Safety Net.
4. I want you to remember this number because it is absolutely critical. It represents the 4-month advance window provided in the MA Reapplications Due Soon report. The Office of Developmental Programs generates this report every single month, giving you a really solid 4-month runway to help individuals prepare for their upcoming renewals.
But where do you actually find this report? Well, it depends entirely on your organization type. A, Bs, and ID/SCOs will find it in DocuShare under the County Dashboards folder. Adult Autism Waiver SCOs, you'll get a monthly email directly from BSSAP, assuming you have individuals due, of course. And the ACAP Managed Care entity will download the 70 REAP file right from CGov. You absolutely need to pull this report to get the names, master client index numbers, and renewal dates so you can start your outreach.
Now, as the official ODP policy reminds us here, just knowing a renewal is coming is only half the battle. The rule is crystal clear. Providers absolutely must verify that an individual is eligible prior to delivering services. ODP cannot and will not pay you for services rendered to an ineligible participant. No exceptions. Because of that, you've got to follow these steps. You need to access the Online Eligibility Verification System, which is known as EVS, to definitively check someone's status before you provide any kind of care. Only then can you safely render those services, knowing for sure that their eligibility is active and your organization's payment is secure.
Now, if you happen to run into batch EVS report issues, or maybe you just need plan information in a pinch, keep this information super handy. Seriously, take a screenshot right now if you need to. That top number, the 24/7 eligibility verification line, is an absolute lifeline for any last-minute service needs.
There's one final technical tool to note, specifically for administrative entities, ECIS. The monthly report we discussed earlier, that just provides an ODP-generated estimate. It's a great reference point, but you must ultimately use ECIS to confirm the actual hard renewal dates locked in by the County Assistance Office. Just remember, you'll need a Commonwealth Biz account to register for access to it. So, we've covered the high stakes, the changing laws under the OBBPA, your essential support playbook, and your technical toolkit. The question I want to leave you with right now is this: how will you adapt your internal workflows tomorrow to ensure zero lapses in care? This really isn't just about compliance. It's about protecting the lifeline for every single individual you support. So take these tools, update your processes, and let's keep that net secure. Thanks so much for joining this explainer, and keep on learning.